It's Mayor Sandy Brown of the town of Orangeville, and this is our COVID-19 update for Friday, May the 1st, 2020. This week, we had some encouraging news. Canada's top health experts reported that COVID-19 curve is flattening. Collectively, we have made this possible by respecting directives on physical distancing, avoiding non-essential travel, and staying at home. Although this development brings us hope, it is critically important that we maintain our current public health measures until we have achieved a 2 to 4 week decrease in the number of new daily COVID-19 cases. As the first wave begins to level, planning for the future has begun. On Tuesday, the Prime Minister announced that the federal, provincial, and territorial governments have agreed to to a set of common principles for restarting the Canadian economy. The process will be gradual to protect the health of Canadians. Each province will develop its own plan. Ontario announced it will reopen the economy through a 3-stage process in the coming months. Stage 1, opening select workplaces, some outdoor spaces, and elective surgeries to begin again. Stage 2, additional workplaces, some larger gatherings, and some service and retail businesses. And stage 3 will be to reopen all workplaces. The province also released more than 60 sector-specific guidelines to advise business owners on how to keep employees and customers safe. The Premier's advice to business was, "We are getting close, so get ready." The guidelines feature practical measures employers can begin to plan for as they prepare to adapt to the new reality of operating during COVID-19. The measures include such things as using ground markings and barriers to manage traffic flow to ensure appropriate physical distancing, installing plexiglass barriers, providing employees with personal protective equipment and hand sanitizer for customer-facing staff, and a place to dispose of sanitizing wipes. I realize you want to know when reopening will happen so we can get back to work and school. Unfortunately, at this point, there are no timelines as the virus still poses a risk to our community. But there is optimism that things will change soon. So we are counting on you to do your part in staying home as much as possible. This week, I had 3 informative town coffee chats. You can watch the video recordings on the Town of Orangeville's YouTube channel. On Monday, I discussed food distribution and supply with Councillor Todd Taylor, Orangeville Food Bank Executive Director Heather Hayes, and Zare's Store Manager Kevin York. The food bank anticipates demand for assistance will continue to grow. Our community has generously responded. Financial donations from the town, local businesses, and individuals has allowed Dufferin Food Share to bulk purchase some food to meet the community need. COVID-19 has spurred an interest in growing food at home. For those without a backyard, you'll be pleased to know the province has lifted restrictions on community gardens. We hope to have an announcement soon on when Orangeville's community garden will open. Gardeners will have to follow instructions from public health, which include physical distancing and regular disinfecting of commonly used equipment. On Wednesday, I had a conversation on community health services with Kim Delahunt, President and CEO of Headwaters Healthcare Centre, Dave Smith, the CEO of Canadian Mental Health Association for Peel and Dufferin, and Jennifer Moore, the Executive Director of Dufferin Child and Family Services. We are so fortunate to have such collaboration between our hospital, first responders, and community partners. We had an opportunity to discuss how delivery of services has changed because of COVID-19. Peel Dufferin Mental Health has a new service model to respond in real time with counseling as soon as an individual calls for help. They are also able to provide virtual follow-up appointments. Dufferin Child and Family Services staff are available 24 hours a day to provide support for child and youth mental health, parenting help, and assistance with disruptive behavior. They also have an online booking system and virtual parenting and youth programs. The hospital is working with community partners to support the Shelburne residents. 10 hospital nurses and PSWs have volunteered to work at the long-term care facility in Shelburne. The spirit of giving can be found throughout our community. All 3 organizations have had generous donations from companies and individuals. An update on the PPE campaign. Headwaters Hospital has enough gloves, but there still is a need for masks and gowns. Friday's Town Coffee Chat is about sports during the pandemic with Councillor Joe Andrews, Rick Stevens, the president of Orangeville Minor Hockey, and Kent Davis, the president of the Orangeville Lacrosse Association. All of these conversations can be viewed on orangeville.ca or the town's YouTube channel. We had a terrific response for our call for art submissions to thank our frontline healthcare workers. We received more than 30 heartwarming pieces of art. If you'd like to see the children's artwork, you can watch the Inspiration from Gratitude video on YouTube. We are now working to create banners of these masterpieces that were created by students and children, and they'll be installed at the vehicular entrances to Headwaters Healthcare Center today. While schools are closed until May 31st, the important business of learning continues. I salute all students, parents, and teachers for all their efforts to ensure children can keep up with their studies. In closing, I wanted to add my sincere thanks to the men and women working in essential services. Our healthcare workers and emergency responders are working tirelessly to keep us healthy and safe. Thank you very much.